On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled OSHA's Emergency Temporary Standard for COVID-19. My name is Chris Mammerl, and I will be your moderator for this program. I'd like to introduce our speaker for today, Isabel DeOliveira, Regional Compliance Assistant Specialist with OSHA. Ms. DeOliveira has been with the U.S. Department of Labor, Occupational Safety and Health Administration for over 20 years. She started as an industrial hygienist compliance safety and health officer, performing worksite safety and health inspections and evaluations throughout all of New Jersey and New York City, including numerous in the healthcare industry. In June 2010, Isabel began providing outreach services as the Regional Compliance Assistant Specialist for the Philadelphia Regional Office. She coordinates all federal outreach activities in Delaware, Maryland, Pennsylvania, Virginia, West Virginia, and Washington, D.C. Her Portuguese and Spanish language skills are critical for effectively reaching many vulnerable workers. Prior to working for OSHA, Ms. DeOliveira worked as an emergency medical technician, environmental consultant, and for a building management company. Ms. DeOliveira earned her Master's of Science in Occupational Safety and Health Engineering. She has over 25 years experience in occupational safety and health in construction and general industry. And now, Isabel, I will turn the program over to you.
Thank you so much. I appreciate Patient Safety Authority for taking the time to offer a session on emergency temporary standard to protect healthcare workers. There really is no way for us to comprehensively cover the topic at hand in 1 hour. So this information is for clarity on existing regulations and law, and the employer is always the responsible party for providing a safe and healthy workplace. I put my information in the chat should you have to leave for whatever reason the session and you'd like to contact me offline sooner rather than later. My information is also at the end if you'll be receiving the information that way. I shared a lot of attachments with the hosts and the main agency. If you have not received them, you can by all means contact me as well so that I can share them with you directly. But I'll be referring to many of our OSHA publications throughout the session today. Again, that is my face. I wanted to share it. I didn't want to put myself on camera because I've had bandwidth issues in this section of the state and Commonwealth. We're going to be covering the OSHA's Emergency Temporary Standard, providing how it goes into the President's COVID Action Plan, how the details of the OSHA COVID-19 National Emphasis Program have changed with that ETS, Emergency Temporary Standard, and I will do my best to refer to the subparts U as an umbrella only as the ETS, because I know some employers and other employees don't know the subparts of the Code of Federal Regulations like the regulators in Washington do. And then last but not least, I could not leave you without compliance assisted resources. There really are a lot. And if you're in healthcare, you can be more than happy to use them, but they really are available to all workplaces. So if you have other facilities that you, again, work part-time per diem or have family members who are looking for resources for compliance with workplace safety and health regulations, by all means share these with them as well. So OSHA's approach has always been to focus on workplace safety and health. The common goal is to work and make sure each worker goes home safe and healthy at the end of the day. We do that balanced approach of what we're known for, the enforcement, outreach and consultation, and then the compliance assistant resources that we'll be mentioning again today. I've had some questions pretty regularly on whether or not the guidance is what covers your facility or if you're covered under the emergency temporary standard. I want to draw your attention to the main OSHA coronavirus page. It's OSHA.gov coronavirus. The way the page is set up, on the left is the requirements for the emergency temporary standard, primarily for healthcare and some of its support functions. Doesn't just mean hospitals, nursing homes, or facilities that provide health care. If your healthcare services in a home care setting or medical health care in a home setting, you would still possibly be covered. It is the employer's responsibility to do the determination of whether you apply. If you think some of your facilities apply and some don't, you're more than likely going to have to just apply it to all of your facilities so as not to create confusion for the employees who work at different settings on different days. And there is information on the frequently asked questions, which I'll be referring to today as well. The National Emphasis Program is underneath that, and the enforcement memos. I provided the July 7th, 2021 enforcement memo updating all of the internal memos that had been rescinded. But again, it's a lot of legal language, and some stakeholders just want to call someone to help them review it. So you're more than welcome to do that as well. In the middle, we'll get to a little bit later. So when you click on that first link, you're going to get to the Emergency Temporary Standard Regulation page. You can see by the notation at the bottom, the web link. It's the coronavirus, but it is now an ETS page. This information has, again, on the left, the regulatory language, as well as a lot of the fact sheets. And we're going to cover some of these compliance assistant resources later on in the presentation. The Emergency Temporary Standard was issued June 10th of 2021. Most of the provisions became effective July 6th. All of them became effective July 21st. There was a open comment period through August, and I'll let you know where that information is should you find yourself in a situation where you want to provide feedback should OSHA put another ETS out sometime in this calendar year. The ETS is to provide protections for workers facing the highest COVID-19 hazards, those in the healthcare settings where they're treating suspected and confirmed COVID-19 patients. Workers that could be covered is hospitals, nursing homes, and other high-risk areas in healthcare settings. Who isn't covered would be if you're non-health caring for patients locations in a hospital. Off-site billing, telemedicine, but again, other the support functions may be covered. Dietary, laundry, so on and so forth. Certainly housekeeping and whoever's doing the disinfecting. Who is not covered, certain facilities that are able to screen patients, delivery people, caregivers, not just patients, and all employees are vaccinated. Again, if you're in a high-risk community-based exposure, you're likely to have put yourself back into the being covered by the ETS. So again, it's mindful to maybe paying attention to the variants, which again, we're going to discuss a little bit later. ETS requirements under 502 have the sections that would be written plan, patient screening, again, that not just patients, but caregivers and anyone else coming into the facility. Face covers, face masks, and then respirators. Paid medical removal for protections. Vaccinations is strongly encouraged. Physical distancing and barrier requirements. Ventilation and cleaning schedule. Reporting and COVID-19 log, which we are going to be getting into in a couple more slides because some facilities are not as clear as to what needs to be reported and what just goes on to the log. All employees and all workplaces are covered under Section 11C of the OSHA Act, but this ETS also specifically has anti-retaliation in its regulation. The Healthcare Workers Emergency Temporary Standard also comes with an enforcement directive. It is publicly available. I sent it as a link. I believe it's about 67 pages. In it, it ensures consistent enforcement of the ETS by establishing the inspection methods, the guidance for verifying exemption, and assessing compliance. Where this is where the employer can use it and stakeholders can look for clarification if they're not clear about the regulatory language. And then it further goes on to some citation guidance, and then CSHO stands for Compliance, Safety, and Health Officer, the OSHA inspector that would be coming out to do the inspection. And it covers their training and protection requirements and other supplemental instructions about how the files get processed into the national office and into our computer system. Again, it reviews the effective dates of June 21st of 2021. July 6th was the main components and provisions that needed to be in compliance, and all provisions were to have been complied with by July 21st of 2021. OSHA will continue to monitor COVID-19 vaccination efforts, but virus variants like the Lambda and Delta and other factors as the pandemic continues, such as community transmission, and will update the ETS as appropriate. And I will show you where you can quickly look for that notation on one of the web pages, as well as you'll be more than welcome to sign up for the OSHA Quick Takes, look at your media outlets, as well as news feeds for any other updates that could be coming in some way to you. So OSHA also updated the guidance for all industries. Typically, this was looking for the posting of August 13th, 2021, and it was looking to re-emphasize the multi-layered control approach to protecting workers, providing workers time off to get vaccinated, isolating sick workers, instructing them to stay home, implementing physical distancing for unvaccinated and at-risk workers in common areas such as break rooms or the time clock or locker rooms, implementing flexible work sites. Not as much telework as the flexible work hours. If you can just stagger the shifts just a bit, half an hour plus or minus the usual start time, so it lessens the amount of people, again, at that time clock, the break rooms, and or change rooms if they have to change for work. Providing face covers to unvaccinated or at-risk workers, and maintaining and improving ventilation systems. And the minimum ventilation system that CDC was recommending was the recommendation of minimum efficiency reporting values, MERV, of 13 or higher if your system allows it. If your system doesn't allow it, you can do disinfecting, and then we're going to cover disinfecting in a bit as well. And it has updated guidance for manufacturing meat, poultry, and seafood processing in a high volume retail and grocery settings. But really, again, because of community transmission, you can certainly we are now providing more information about protecting unvaccinated at-risk workers in those higher risk workplaces with the community exposures as well, and those mixed vaccination status workers. The best practice is using some of the information that is available to all stakeholders, as I had mentioned, using the checklist or employee job hazard analysis, which we'll be going to actually right on the next slide. So by conducting a workplace risk assessment, contact tracing, preparing that response plan with the multi-layer controls, taking steps to improve the ventilation, again, will improve the facility from having exposures and or transmission of exposures at their work site. This is a screenshot of the web link at the bottom. I also sent it, I believe, as an attachment. So it is, again, that COVID-19 healthcare work site checklist and employee JHA, or job hazard analysis. The checklist is about 11 pages if you choose to print it. And what happens is that the employer will make an assessment if the employee is potentially or has been exposed to a suspected or confirmed COVID case. And so you can do an analysis and then see if you need to implement your mini respiratory protection program. But again, this document can be used by any facility. So it need not just be used by healthcare, but because it is mentioned in the ETS, it is required for the healthcare facilities. One of the other requirements for employers that are covered under the ETS is the COVID-19 log. And if you have 10 or more employees on such and such a date, as per 1910-502Q as in Queen, employers are required to keep this record of any employees that are confirmed COVID-19 case. Now, it could be an asymptomatic case, so you do need to track that as well. But any employer who wants to use the COVID-19 log for contact tracing or other purposes can do so. Just happens to be a link example of a COVID-19 log. As long as all this information that the agency would be looking for during an inspection is available. And again, should an employee get COVID-19 in such serious case and need to be an inpatient hospitalization, they would have to be, the employer would have to report to OSHA directly as per record keeping requirement. We'll get into that further as well. What happened with the National Emphasis Program having to be revised when OSHA issued the emergency temporary standard. So the March 12th, 2021 directive was canceled, and this was the revised header. So the numbering isn't very different, but there are some minor changes in the National Enforcement Program as to why OSHA would maybe come do an inspection at your facility. OSHA first issued this National Emphasis Program in March, and it revised it in July. It's based on the latest scientific guidance of a review of the enforcement data from March and that issuance that we were just talking about. The National Emphasis Program follows along with the revised guidance in having a focus onto specific high hazard industries or activities where COVID-19 is prevalent. Its appendix has the NIACS for non-healthcare settings most commonly encountered in OSHA COVID-19 enforcement activities. And once again, it has a preventing retaliation against workers who complain about unsafe or unhealthy working conditions and exercising their other rights under the OSHA Act. OSHA's programmed inspections would come after complaints, referrals, or severe illness reports, but it does have a mechanism so that employers are interested in how OSHA could be coming out on a program inspection. It's reviewed for you. And again, this was the notation that we removed list of secondary targeting industries because they are now covered under the OSHA emergency temporary standard. What's the priorities for the national emphasis? Unprogrammed are again, fatalities, complaints, referrals, follow-ups. If an employer did receive citations, we may come out and do a follow-up inspection, and then employers who would be in the industry codes that are in the updated June 2021 National Emphasis Program. And the document's name for non-healthcare inspections will follow that June 2021 updated interim enforcement response plan. In this document, it reviews the rescinding of the policy memo for inspection discretion with regard to employers reusing, filtering face-based or other respirators when stock and supply was in short demand or hard to find, as well as the annual fit testing allowance to be extended. Those memos have been rescinded. So again, the June 2021 updated interim enforcement response plan becomes an important document if you were extending those allowances at your facilities or chapters across the country. Healthcare inspections, as I mentioned earlier, are following the compliance directive inspection procedures for the COVID-19 emergency temporary standard. Also a requirement of the National Emphasis Program is to do outreach and compliance assistant sessions like today. We'll also be doing nationwide outreach with industry, labor, alliances throughout the duration of the pandemic. We'll be doing continued outreach through letters, news releases, social media, and quick takes. Seminars are tailored to specific audiences, so if you think there's a better fit with a different audience, by all means get in touch with me. I'd be more than happy to fit it into my schedule to do work with those audiences. We also have federal agencies points of contact. We also have field federal safety councils, and I work with those as well. One of the primary requirements under 1910-502 is disinfecting of services. This happens to mention bloodborne pathogens because there's also a requirement for disinfectants there. And the notation is that you need to be mindful of the EPA registered disinfectant. Cleaners, disinfectants, and sanitizers mean different things, and your employees do need to know what those things are. In a little bit, I'll be reviewing the citations that we've issued under the new regulation, and you'll understand why we're covering this in a little bit more detail. It's been found. So bloodborne pathogens are addressed in list E as an Elliott for the list of disinfectants. For COVID, it is list N as in Nancy. So that would be the COVID-19 disinfectant page. Disinfectants are rated and listed under EPA. Not sure why, it just is. What you'll find once you get to that link is this. You'll have the EPA, you can sort EPA registration number, active ingredient, use at the site, surface type, contact time, browsing all, or search word. If you were to browse all, you will find that there are 576 disinfectants as of earlier this week, but you need to be mindful of what the contact time requirement for that chemical. If your employees interviewed during an OSHA inspection are unaware of what contact time means, it could possibly a citation if they're not understanding that certain disinfectants need to be left on surfaces for a certain amount of time. As an example, if you select 1 minute of contact time or less, you will find 152 listed disinfectants. If you up it to 5 minutes, you're now at 323 listed and rated disinfectants. So it is very meaningful for the facility or health system, should you order your chemicals that way, understand what your chemicals are being ordered. Are they on the registry list? Cross-checking that with the safety data sheet, label, and the technical information sheet. may have to do some hazardous communication training if your employees are not clear on what's being ordered, what's being used, and how the proper way to use it. For example, gloves and protection. Is it a latex glove, nitrile glove, butyl glove, so on and so forth for the proper protection. Stock and supply was also an issue during the pandemic for a few months, so employees who were responsible for the purchasing and reordering may have been looking at the name and not at the exact registration listing. So not just because it's one name over another, it may not be exactly the same. So as you know, not all cleaners or disinfectants are the same. Employees need to be trained as per hazardous communication requirements and personal protective equipment requirements. EPA did this great job of putting together a one-pager. I have linked it on the two-page OSHA resource page for today's session. And you can see, checking your product, EPA is approved, reading the directions and instructions. It could be very small print, so you do need to be mindful of maybe referring back to the technical information sheet. Free cleaning the surface if it's grossly contaminated. Step 4, I think, should be the highlight of the sheet, following the disinfectant contact time. Wearing gloves and then washing your hands. And again, in finer print, it says dispose of the gloves once you're disinfected the surfaces. And then step 6, locking up your chemicals so other little hands cannot get a hold of it. Switching back to OSHA record keeping. It is not a new regulation, but it is new to some, that as of January 1st, 2015, employers were to have reported through the 1-800 number 321-6742 or local area office, or there is a online reporting system for all workplace related fatalities within 8 hours. All work-related inpatient hospitalizations of one or more employee need to be reported within 24 hours. And this would be the case for under a pandemic if employees have medical treatment that needs to be due to the COVID COVID exposure, they would need to be reported as such. If employee dies of a heart attack and it's unclear whether it's work-related, I would recommend reporting it and then letting the agency make the assessment. We have been getting reports throughout the pandemic. We do not do inspections on every single one of the reports. We could handle it with a severe injury reporting letter of request for what the employer has done to assess if it was truly work-related or if there is a working condition that needs to be assessed, or job hazard analysis to tweak the work so that other employees are not going to be exposed to the same hazard. Also, workplace amputations. Soft tissue, fingertip, it does not require bone amputation for it to be required reporting. That is a 24-hour required reporting. And all work-related loss of an eye needs to be reported within 24 hours as well. The question has come in, Isabel, what if it happens to be a Saturday and I get notified? Don't wait. Call the 1-800 number. It's always staffed, and it'll get the message to the proper zip code area office that needs to be notified. Also, what if you were notified late, 2 or 3 days later of the inpatient hospitalization? Again, report it as soon as you hear about it so that you have done your due diligence about getting the report in about the workplace fatality or the inpatient hospitalization. Here's how you report: by telephone to the nearest OSHA office during normal business hours, typically Monday through Friday, 8 to 4:30, non-federal holidays, the 1-800 hotline, 1-800-321-6742. And OSHA has now developed the means of reporting by OSHA.gov reporting online. I would also recommend just doing it for the 50 states and the territories and District of Columbia. Should your facility be covered under a state plan state, for example, Maryland or Virginia, Maryland has MOSH and Virginia has VOSH, we'll get the information to the proper area office within those state plans. Now on to the compliance and system resources. Employees have access to all this information. Stakeholders have access to the information. Again, this is another screenshot of that main OSHA.gov coronavirus page. And it has in the middle that guidance information. It has it in a blue box that it was updated August 13th. Doesn't have the year, but once you click on it, you'll see that it was 2021. Has a summary, has a recognition. It also reviews some non-ETS COVID-19 frequently asked questions. So that would be helpful for a lot of facilities. When you get to that next page, it again was it notates that the guidance was posted on January 29th of 2021, updated in June, and then its summary of changes made subsequently on August 13th, 2021. So these are pages that OSHA will announce that we've updated the guidance. Please refer back to it. In this case, the name of the page is OSHA.gov Coronavirus Safe Work. Lower down, there was the frequently asked questions. This information is typically updated. I reviewed it earlier this week. That's why I said it was reviewed in October of 21. Not a lot of changes as of yet. Again, OSHA is working expeditiously to review President Biden's COVID-19 action planner, which was revised on the 9th of September, 2021. And when we release information, we'll do it through the main coronavirus page, social media, press releases, as well as newsletters with its stakeholders. If you're looking for frequently asked questions related to just the COVID-19 page and standard, you can link to that here. You don't necessarily have to go back to the ETS page. I do have a screenshot of it later on so that you can see it's formatted just a little bit differently. Because it's an emergency temporary standard, the questions relate to each of the subsections, and I screenshot that. Here's the header I wanted to bring attention to. To assess the ongoing need for an emergency temporary standard, OSHA will be reviewing the changes monthly. So this has a notation of the October report. Again, it does not say October of 2021, but that this is the notation. We're on October 14th, so I would say probably in and around November 5th, maybe, this page may get a review. If the ETS needs to be rescinded, it'll be rescinded, but more than likely it'll just say November report. So again, that'll be something that you can look at to see if you're current, is your facilities current with compliance, and or have there been any changes to the ETS, or has another one been published? Here's the example of the screenshot of what the the frequently asked questions ETS page will look like. And each of these has the down arrow, what costs must employers bear to meet the OSHA requirement of the OSHA COVID-19 ETS. All costs is what it's going to say. Same thing with determining, how do I determine if the small employer exclusion for record keeping applies to me? This is 502Q requirement. A lot of the other OSHA resources all have links so that you can see that there's information on the COVID-19 plan. The template of the plan is going to be the hazard assessment for C under 502. And employer citations have been issued for not having done a proper hazard assessment. So again, OSHA has published a template form so that employers can use it to help them assess their workplaces. Employers outside of healthcare can also use this template to help them be more compliant if it applies to your workplace or portions of your workplace, for example. OSHA also published a general employee training presentation, and this one is for the emergency temporary standard as a whole. It is about 40 slides. Information is downloadable. You can use it at your leisure and use it as a starting point, and then add in employer specific elements. The mini respiratory protection program is only about 20 slides, and this information as well is posted on that ETS page on the right side. Many employers and their stakeholders have asked me about what is OSHA finding when it does inspections. It has been a topic that is so frequently asked under the Freedom of Information Act, FOIA, that we have published it. It is on our data and statistics page. I have linked it on the 2-page OSHA resource sheet that was shared and or posted with the audience of today's session. And you can see it on the right side of the screen under COVID-19 data. Bullet number 4 is inspections with COVID-related citations. And you can see that not so much the employers, but the things that we're finding during these inspections. 1910-134, that's respiratory protection. The next inspection down, again, respiratory protection. Other citations could be a 502C, which would be the COVID plan. A C41, C4 Roman numeral I is the hazard assessment. C4I, yes. A C6 would be the ongoing monitoring of that plan. H1 would be physical distancing. 502I is the physical barriers. 502N2 would be training requirements. Then we go into the next inspection, and again, respiratory protection and the coronavirus ETS for in healthcare. OSHA Act 1970 Section 5A1 is the general duty requirement that employers provide a safe and healthy workplace. This is probably a citation for a facility that is outside healthcare that still has the responsibility to provide a safe and healthy workplace and ensure it. So information is publicly available, and that's where you go to find it. Again, the OSHA Quick Taste is a very easy way to get the OSHA newsletter delivered twice monthly to your device. It's mobile friendly and or your desktop email. Latest news about the OSHA initiatives, products, and other resources to help employers and workers find and prevent workplace hazards. The OSHA poster is downloadable. It has not been updated in a few years. It does mention the reporting requirements that were updated in 2015. Also, these posters are available in other languages, such as but not limited to Spanish, Haitian Creole, Korean, Polish, Portuguese, and Vietnamese. Spend a few minutes here talking about the OSHA onsite consultation program. It is really an underutilized service that each state is required to have, and it's confidential occupational safety and health service at no cost to the employer. If you're a small or medium-sized business, less than 100 employees, you can request a confidential review in any of the 50 states, District of Columbia, and several of the territories, and it prioritizes high hazard industries. During the pandemic, they have pivoted it and added virtual visits. So if that's something that fits into your model of what you need, if you're just needing training or technical assistance for drafting a COVID-19 plan, the virtual option might work for you. If you're looking for the on-site review of a noise assessment or another chemical hazard that needs air sampling, you can do that with them as well. It's separate from OSHA enforcement because it's run out of state agencies or universities. In Pennsylvania, it happens to be run out of IUP, Indiana University of Pennsylvania. But they cover all of the jurisdictions at OSHA, including the state plan states. That scope of request is determined by you. Some of the web pages have a request button. You don't even need to email or fax a letter. You can just do it right there on the computer. Hazard identification and correction is their biggest request. If your safety and health program is of quality, it can be recognized with the safety and health recognition program, and or they can help you draft safety and health program if you're looking to improve your work business model and apply for different contracts, either at the state, Commonwealth, or federal level. The service is free and confidential by law, and it is exempt from OSHA programmed inspections while the visit is in progress. And oftentimes, if OSHA come in on a programmed inspection, if consultation has come in, OSHA agency under enforcement does not find the same hazards because you've corrected them. That's the requirement of using the consultation service. But again, it's free, and training and technical assistance is available. I hope you have found this information helpful. We covered the OSHA Emergency Temporary Standard under Subpart U, umbrella, reviewed some of the requirements that have been issued and cited most recently, and identified the compliance assistance resources that are readily available to you, and I'm hopeful that you will use them. If you need to contact us, you are more than willing to email questions through the OSHA webpage. As a matter of fact, the ETS questions page has over 98, 99 questions, as well as the toll-free number. You can reach us there. I put my information in the contact on the chat, or you can call your local OSHA office. My information is here, 215-861-4931. And if there's any questions at this time, I'd be more than happy to take them.
Thank you, Isabel. We have a question. Can businesses that are larger than 100 employees receive free consultation?
Yes, they can request it. And based on high hazard industries, each state can make the determination how much of their resources can be used for that function. But yes.
Because you said that the on-site consultation was small and medium facilities, which was up to 50 employees?
100.
But
if you're close,
yeah,
if you're closer to 100 than say 5,000, then more than likely they will add you to their list. They are trying to do the best they can with prioritizing the high hazard due to COVID. And I know in Pennsylvania they're doing a pretty good job, but some states, just based on volume, they have quite a backlog. But Delaware does not. So each individual state runs their own consultation program.
As we're waiting for more questions, is there anything else you'd like to share?
Again, facilities have the responsibility for providing a safe and healthy workplace. A lot of facilities have come in with questions about the record keeping. Because we're in the middle of a pandemic, employers think that their positive COVID case isn't going to be a recordable or a COVID-19 log listed. And my recommendation is to really consider the probability of contracting the COVID-19 at the workplace. If you're in healthcare and you had a cluster, that is probably something agency would look into why you didn't record it on your OSHA 300 and or your COVID-19 log. Also, the required reporting if there was an inpatient hospitalization. I do know there are some inspections that have citations that were possibly issued and not settled, and they haven't made the page. I will make that notation at the top of this page of the inspections with COVID-19 related violations. It's updated about once a week. And the date at the top of this one is Friday, October 8th. So it's probably going to be updated again tomorrow at some point. But typically these are settled cases as well. Employers have a right after an inspection, if they want to contest, to do that and then go before an administrative law judge and so on and so forth. So there's probably other citations that just haven't been final ordered. And that's a little bit of our legal language.
So I have a question that came in. How do you know if it's from the workplace or outside in the community? And is it important to make that determination?
The employer has to do a reasonable consideration as to that. Again, a healthcare facility with treating suspected or confirmed COVID patients are going to have to show reasonably why they think it is not. Again, it could be during an investigation that it shows, the employee's spouse, sibling, so on and so forth, had it first, and that's how they think they got it. And also the rest of the facility did not have any other positive case. I had one facility that had a cluster of 3 or 4 from the lunchroom exposure. They took the time and the money to do testing of pretty much the whole rest of the facility, and they only got one asymptomatic case, but it wasn't even the same department. That would be reasonably not recorded. But those 4 or 5, because it was very much the same shift, same department, it's hard to say it wasn't work related.
Okay, thank you. I would just ask if you could review again where people can go to sign up to get updates, because I know this information is evolving constantly and there's always changes. So if you could just remind everyone where they can sign up and be notified when there are updates and changes.
Mm-hmm. There's the OSHA tip of the day. There's the OSHA quick take, the OSHA newsroom. There's Twitter. And so I've put the OSHA quick takes notation in the chat.
Thank you. Yeah, I knew there was a lot, and I figured we can go over those again so people can stay up to date and current.
I will share that under the archive documents in November of 2020, we issued a common COVID-19 citations, helping employers better protect workers and comply with OSHA regulations. I'm listing the link in the chat. It's about a 6-page document, and it has the citations that were issued up until that point, which was again November of 2020. Heavy on respiratory protection. It is not in sequential order to the regulation. It is frequency of citation. So it's a little bit out of order. A lot of 1910-134 and then it goes into record keeping and recording, which is the 39 regulation, personal protective equipment, and then the general duty. So, and it goes into a little bit of the description of what that regulation would read and the available resources on the right. It is technically an archived document, but it, based on the other question of wanting to see what other citations have been issued for COVID in October of 21, I'm putting it in the chat.
So I see that we have no more questions right now. So I think we're going to go ahead and end our program. For anyone that was unable to ask a question, or if additional questions come up, please feel free to email them in, and we'll try to address those as they come. Otherwise, thank you very much for attending, and have a nice day.